Hello doctor, I hope you watched my previous series where I shared the 4 medical negligence. I hope you understood completely. If you do not watch that, please go and watch it again and you can jump into this video where you can get next 4 medical negligence. So you can watch this video until the end. So after watching this video, I hope you will implement these 4 negligence rules and regulations in your hospital strictly and maintain your output. So I don't want to waste your time. Now we get started the next 4 medical negligence. And negligence number 5, drug and drug device related problems. Faulty drug devices or incorrect drug administration methods can cause significant harm. For instance, administering drugs interventionally instead of orally can lead to severe complications. So make it everything possible very clear. A notable incident recently in Bangalore hospital where a patient was given an incorrect IV dose resulting in life-threatening complications. So just imagine what patients think from their perspective if we do this kind of mistakes regularly in our hospital. So for that, you can take my advice. Advice number 1, regular maintenance. Regularly maintain and check medical devices to ensure they function very correctly and accurately. So I know very well many hospitals do not maintain the device properly, especially the calibration. They think a lot for putting money into the calibration. So my advice is please doctors and healthcare professionals and owners take this initiative and do the calibration regularly, so then your patients can get the best output. And advice number 2, incident reporting. Establish a system for reporting and analyzing device related incidents to prevent this kind of errors. Negligence number 6, incorrect drug administration. Incorrect drug administration is a major and vital issue often caused by misunderstanding instructions or lack of proper training of your doctors or the team members. For example, a patient in Mumbai hospital received an oral medication wrongly, leading to severe adverse effects. So how to avoid that? My advice number 1, standardized procedures. This standardized drug administration procedures across the hospital you have to keep mandatory and keep it very strictly. And advice number 2, comprehensive training. Again, I'm telling you, the providing comprehensive training for all healthcare providers and your staff and your team member on these procedures. And advice number 3, regular reviews. See, again, I'm telling, so many people do not do this kind of activities. So regularly review and update these protocols to incorporate the latest best practice. And negligence number 7, it is also very important, failed communication. Communication failures are a root cause of many medical errors. In Delhi, studies have shown high incidence of adverse drug events due to communications breakdowns. Specific cases involved miscommunications between the surgical team and nursing staff, leading to incorrect post-operative care and patients' deterioration. Just imagine, doctors, how serious issues are. So for that, my advice number 1, open communication. Foster a culture of open communications within your team and doctors. And advice number 2, standardized tools. Use very standardized communication tools like situations, background assessment, and a recommendation to ensure clear and concise information exchange. Advice number 3, regular meetings. Hold regular team meeting to discuss patients' care plans and address any communications gap happen in your hospital. And finally, I'm going to reveal that negligence number 8, lack of patient education. See, again, imagine that lack of patient education leads to improper medication use and non-compliance. A notable case which happened in Tamil Nadu, a woman who conceived despite sterilization due to insufficient post-procedure guidance. It highlights very clearly the critical need for thorough patient's education. For avoiding these issues, I would like to give some advice or you can take some tips. Tip number 1, clear instructions. Ensure patients fully understand their treatment plans and medication usage by providing clear and very profound written instructions and formats. So I know many hospitals, they share all information verbally. They don't have any protocols or any structured written format in their hospital. And tip number 2, encourage questions. Encourage patients to ask lots of questions, and they can get clarity and doubts on their treatment. And tip number 3, follow-up. Implement follow-up procedures to check on patients' compliance and understanding of their treatment. And again, I'm telling, so after visiting 40 plus hospitals and meeting lots of healthcare entrepreneurs, I know very well they don't have this kind of structured infrastructure in their hospital. So by addressing these areas in detail, you can significantly improve patient safety and healthcare outcomes. The continuous education and stringent protocols and effective communication are key to minimizing the risk of medical negligence. As a doctor and healthcare professionals, let's commit to providing the highest standard of care in your practices. Now I hope you have a very clear understanding of what medical negligence is, the different types, and how you can train your team members to prevent this kind of issues. If you want to know more about the medical negligence, I have provided some resources links below in my first comment. You can take for your more information. And finally, if you found this video very helpful, please hit the subscription button and click the notification bell so you won't miss any future updates and valuable knowledge which I am sharing with doctors and healthcare entrepreneurs. So my recommendation is keep watching, keep updating, keep flourishing. Until then, Abdul Latif signing off.